Bismillahirrahmanirrahim. Assalamu alaikum. My name is Emma Nuruz and my roll number is BP 1450008 and I'm the student of 4th professional morning and my group number is 58. So the major topic that was assigned to my group was principles of infectious disease and my subtopic is antimicrobial dosing. Okay, let's talk about antimicrobials first. What are antimicrobial drugs? Antimicrobials are the drugs simply which are chemical substances of natural or synthetic origin that suppresses the growth of or destroy microorganisms, including bacteria, fungi, helminthes, protozoa, and viruses. It simply means that the antimicrobials are the chemicals, the drugs, which works against some causative agent like like viruses, protozoas, bacteria, and etc. And these agents or these drugs or these chemicals are going to kill these infectious causative agents and are going to cure the disease. And there are so many mechanisms by which these drugs or these antimicrobial agents work in order to kill the pathogens or the causative agents of some infectious disease. Okay, so antimicrobial dosing. Antimicrobial dosing simply means that in which way or how we should prescribe the dose of the antimicrobial drugs. And for that, there are so many factors that should be considered. So the choice of dosing regimen is based on factors, it's including the patient-specific factor like weight, patient's weight, infection site, and route of elimination. These must be considered. So some general factors are: first is the anatomic and physiological barriers. Anatomic and physiological barriers also must be considered in evaluating dosing regimen. For example, penetration into the CNS requires high doses to ensure adequate antimicrobial concentrations at the site of infection by crossing the blood-brain barrier. It simply means that if you want to cure or treat some infection or infectious disease which is at the level of CNS, so we need to give higher doses of the antimicrobial drugs because these drugs have to cross the blood-brain barrier. That's why they are going to be given in the higher doses so that they can produce their effect at CNS. Okay, second factor is site of infection. The infection site also requires different dosage requirements. An uncomplicated urinary tract infection requires low antimicrobial doses because of the high urinary drug concentrations that are achieved. In contrast, a more serious systemic infection such as pyelonephritis requires increased antimicrobial dosage to achieve the therapeutic drug levels in tissue and in serum. Next is the route of elimination. It must be considered also that the antimicrobial drug that we are going to give to the patient, from where it is going to be eliminated from the body. Like it is going to be eliminated from the kidney, that is, it has a renal clearance, or it has a metabolism through the liver. Means renal function means we have to take care of the route of elimination because it is also very important factor that affect the dose, and this must be considered before prescribing the dose of the antimicrobial drug. And renal function can be estimated via 24-hour urine collection or with equations such as the Cockcroft and Gault equation, which is simply the equation to calculate the creatinine clearance of a patient. Patient's age. Now, this is also a very important factor. Patient's age must be taken into consideration. We should consider that the patient that has arrived to us belongs to either a young age group or a neonatal group or a geriatric patient. Means whether his age is he's an old patient or he is a young adult or he is an infant or a neonate. So it is also again a very important factor before prescribing the dose of the antimicrobial drugs. Okay, now fever. Why fever here is because fever is a very common it's a very common symptom in most of the infectious disease. So that's why we are considering here the fever as a factor which also affect the dose of the antimicrobial drugs, because it may increase or decrease the blood flow to mesenteric, hepatic, and renal organ system and can either increase or decrease the drug clearance, so may affect the antimicrobial dosing. Now here I have a chart in which there are some common drugs, and I have described the adult antimicrobial dosing guidelines for some more common administered antimicrobial drugs. in which these antimicrobial drugs are prescribed in the dose according to the creatinine clearance rate of the patient. Now let's talk about the case study. RG, a 63-year-old man in the intensive care unit, underwent emergency resection of his large bowel. He has been intubated throughout his post-operative course. On day 20 of his hospital stay, RG suddenly becomes confused. His blood pressure drops to 70 by 30 mm of Hg with a heart rate of 130 beats per minute. His extremities are cold to the touch, and he is present with the circumoral pallor. His temperature increases to 40 degrees centigrade and his respiratory rate is 24 breaths per minute. Copious amounts of yellow-green secretions are sectioned from his endotracheal tube. Physical examinations reveals sinus tachycardia with no rubs or murmurs. Decreased breath sounds are observed on auscultation. The abdomen is distended and RG complains of new abdominal pain. No bowel sounds can be heard and the stool is goic positive, means there is a blood in the stool. Urine output from the Foley catheter has been 10 ml per hour for the past 2 hours. Erythema is noted around the central venous catheter. A chest radiograph reveals bilateral lower lobe infiltrates, and urinalysis reveals less than 50 white blood cells per high power field. Okay, so the blood tracheal aspirates and urine cultures are pending. Other laboratory values include the levels of sodium, potassium, chlorides, and etc. Okay, RJ's medical history includes temporal arteritis and seizures chronically treated with corticosteroids and phenytoin. Perioperative stress doses of hydrocortisone recently were administered because of his surgical procedures. A gram stain of RG's tracheal aspirates shows gram-negative bacilli, which was found to be Serratia marcescens, grew in the culture. Explain the case management with the best possible antimicrobial drugs with suitable dosing. Okay, let's talk about the SOAP notes of this case study. So first, subjective. In subjective, we are going to describe about different things regarding the patient himself. So the age of the patient is 63 years old, gender is male, and the present common symptoms are cold to touch, circumoral pallor, sinus tachycardia, decreased breath sounds, confusion, abdominal pain. And the medical history includes temporal arteritis and seizures chronically treated with corticosteroids and phenytoin. Perioperative stress doses of hydrocortisone recently were administered because of surgical procedure. In objectives, let's first talk about the vitals. Blood pressure drops down to 70 by 30 mm of Hg. Heart rate is 130 beats per minute. Respiratory rate is 24 breaths per minute. Body temperature increases to 40 degrees Celsius, while the other vitals include copious amounts of yellow-green secretions and which are sectioned from his endotracheal tube. Imaging results. In imaging, we have chest radiograph that was done, which reveals bilateral lower lobe infiltrates. Now, the laboratory data of urinalysis gives less than 50 white blood cells per high power field. Sodium levels are 131 milliequivalents per liter. Potassium is 4.1 milliequivalents per liter. Chloride is 110 milliequivalents per liter. Carbon dioxide is 16 milliequivalents per liter. And the blood urea nitrogen, that is BUN, is 58 milligram per deciliter. Creatinine is 3.8 milligram per deciliter. Glucose is 320 milligram per deciliter. And the serum albumin is 2.1 gram per deciliter, while the hemoglobin levels are 10.3 gram per deciliter. And culture test and gram staining results that gram stain of RGs means patient's tracheal aspirates show gram-negative bacilli, and Serratia marcescens growth from a culture of RG's tracheal aspirate. Now let's talk about the assessment. Okay, as we have seen a lot of things, a lot of signs that that belongs to the infectious disease. Let's suppose first here, for example, RGs has numerous signs and symptoms consistent with an infectious disease, like increased WBC, that is the white blood cells count, because we know that in an increased WBC count commonly is observed with infectious disease. particularly with the bacterial pathogens. Moreover, the patient's temperature is 40 degrees centigrade, and fever is also a very common manifestation of infection. The bilateral lobe infiltrates of the on the RG's chest radiograph. The presence of copious amount of yellow-green secretions from his endotracheal tube and the erythema surrounding his central venous catheter are also a very good signs of the infectious process. And if we talk about the blood urea nitrogen, which is 58 milligram per DL, and increased serum creatinine concentrations, which is 3.8 milligram per deciliter, are consistent with decreased renal perfusion secondary to sepsis. Means there is a sign of sepsis too. So here the RG means the patient is confused, his extremities are cold, and the area around his mouth appears pale. All these signs and symptoms provide strong evidence that he is in a septic shock. So above assessments indicate that patient is clinically septic and with a possible serratia pneumonia. Okay, now the plan. So the therapeutic treatment includes the serratia was determined to be susceptible to the ciprofloxacin. So first, the ciprofloxacin was given through the IV route, and the dose, an IV dosage of ciprofloxacin at 400 milligram every 12 hours was prescribed. But due to the reduced renal function of the patient, the dosage should be that the dosage was suggested to be reduced or decreased to at least 200 to 300 milligram every 12 hours. If respiratory status remains unchanged after this treatment with ciprofloxacin, so ciprofloxacin should be discontinued and cefotaxime or ceftriaxone plus gentamicin can be started in the patient empirically. But considering the severity of the patient's infection and his elevated creatinine level, he is not in a condition that he is not a candidate for a single daily dose of aminoglycosides, that is 5 to 6 milligram per kg every 24 hours. We are talking about the gentamicin here. So his current renal function requires a reduced gentamicin dose to treat his infection. That's all. Thank you.